The instruments we'll be using to take blood pressure is going to be the sigmo-manometer. These devices usually include an arm cuff and a squeeze bulb to inflate the cuff, a stethoscope, and a gauge to measure blood pressure. You want to position yourself to have the best opportunity to hear the blood pressure and see the manometer scale. Take control of the client's arm while having it supported by some piece of furniture. When listening to the sounds, make sure that your stethoscope is flat and placed completely over the client's brachial artery. The room noise should be at a minimum and the temperature should be comfortable, 21 degrees Celsius to 23 degrees Celsius or 70 degrees Fahrenheit to 74 degrees Fahrenheit. If you have some form of sinus congestion, your ability to hear the blood pressure sounds may be diminished. Clearing your throat before attempting a blood pressure measurement may be helpful. The client should be seated with the feet flat, the legs uncrossed, and the arm free of any clothing and relaxed. The arm you are using for the blood pressure measurement should be well supported by you or resting on a piece of furniture. Your client's back should also be well supported. You want the arm elevated at heart level and you want to use the proper cuff size. You want to align the artery mark with the brachial artery. You also want to make sure that the stethoscope ear prongs face forward. You want to place the bow of the stethoscope over the brachial. Do not place it under the cuff. You turn the valve to the right. You inflate to 180 millimeters of mercury or 20 millimeters of mercury above first quarter cuff sound. Turn valve to the left to release at a rate of 2 to 5 millimeters of mercury per second. Time frame to wait between readings, it is debatable, 3 to 5 minutes. The lower border of the cuff, as we can see right here, should be about 1 inch above the crease of the elbow. There are two important sounds to listen out for. The first initial sound, or the onset of sound, sounds like a clear repetitive tapping. Sound approximates the systolic blood pressure, the maximum pressure that occurs near the end of systole of the left ventricle. The last sound you want to look out for determines the diastolic blood pressure, and it sounds like the complete disappearance of the sound. You want to rapidly deflate the cuff to 0 after the blood pressure of this individual who I assessed was 130/90. You want to wait 1 full minute before repeating the blood pressure measurement. Average at least 2 blood pressure readings to get a true sense of an individual's blood pressure. It is suggested that blood pressure readings on clients be taken on at least 2 separate occasions to screen for hypertension. This table right here shows the blood pressure classification. Normal blood pressure should be less than 120 for systolic and less than 80 for diastolic. Pre-hypertension is going to be systolic blood pressure between 120 and 139 and diastolic blood pressure between 80 and 89. Stage 1 hypertension is going to be systolic blood pressure between 140 and 159 or diastolic blood pressure between 90 and 99. Stage 2 hypertension is any systolic blood pressure above 160 or diastolic blood pressure above 100. Thank you for watching. Here is a citation.